like to thank Dr. Tutkan for inviting me to join you today. My topic is occupational chemical exposure in healthcare industry. And as I have about 10 years experience leading the occupational health in a big medical city, I mean the world industry. And from this presentation, you will know that hospital is a plant with a lot of hazard. As you know, thousands of tons of chemicals are introduced in our world. Not all of them pass the toxicological data, exposing the workers to a lot of hazard and health effects, including rubber, soaps, paints, medication, and others. According to the WHO in 2004, about 5 million deaths and 86 million disability adjusted life years were attributable to environmental and occupational exposure resulting from the uncontrolled management of selected chemicals. On the other hand, healthcare industry is a fast growing sector. In USA only, this industry employing over 18 million workers, and even the control measures done for the healthcare workers, still we see cases of non-fatal occupational injury and the illness with them, and this is among the highest of any industry sector. So, what are the uses of chemicals in a hospital? They are used to treat patients, to diagnose diseases, to perform surgery, to provide dental care, to protect healthcare workers using personal protective equipment, including gloves, which may be made from latex, to clean, disinfect, and sterilize wards, work surfaces, and in the era of COVID-19, also to clean the air using hydrogen peroxide, ultraviolet rays, and other disinfectant, to sterilize medical supplies and instruments, and also to control the pest which might be present in a hospital, and to maintain the healthcare building if there is a construction need to be done in ICUs, in OR, in patient wards, and to manage the medical waste. What are the at-risk group to this chemical for this exposure? Indeed, all persons, all workers in a hospital are exposed to these chemicals, starting from physician, nurse, dentist, staff in emergency service, ER, ICUs, pharmacist, lab professional, housekeeping staff, even laundry staff, utility and maintenance staff, horticulture and pest control, and other even admin staff can be exposed to these chemicals. I'm not speaking about exposure to patient and visitor. Of course, they will be exposed, but my presentation is concentrating on the healthcare worker that provide this service. In the next section, we'll speak about the types and location of these chemicals which might be present in the healthcare industry or a hospital. So anyone can do a risk assessment of this exposure in his hospital. So the first place is the medical lab that do a lot of chemical processes to diagnose disease using a lot of a variety of chemicals. The most famous chemical such as formaldehyde, toluene, xylene, solvents, mercury, and others. The same like the medical lab, the research center, animal house, the exposure may be similar to the medical lab, and they add to this nowadays nanomaterials, which they start to use nanomaterials in research, especially in the medical field. Dental lab, making all the things needed for the dentist, they use also variety of chemicals like acids, cyanoacrylates, methyl methacrylate, solvents, silica, heavy metals, a variety of heavy metals that Dr. T told us about it, like mercury, nickel, chromium, cobalt, beryllium, and others. In the mortuary, exposure to chemicals can occur like formaldehyde, fixative solvents, disinfectants, even latex if they use latex gloves. In the sterile store department where they sterilize the surgical instruments, some of them are temperature sensitive, other non-temperature sensitive, so they use ethylene oxide, a well-known hazardous material, glutaraldehyde, hydrogen hydroxide, and other disinfectants. Housekeepers use a variety of chemicals like disinfectants, quaternary ammonium, phenolic, bleach, iodine, chlorine. All of these chemicals expose them to a lot of hazard. In the OR, surgeons and the staff in the OR also exposed to a variety of chemicals, especially anesthetic gases like nitrous oxide, and halothane isoflurane, for example, and also exposed to formalin if they will collect biopsy and send it to the lab. Sometimes they store it in the OR. In the laundry, they use detergent, emulsifier, bleaching agent, neutralizer, and softeners. Maintenance workers who are responsible on doing construction, renovation, should be approved by what we call ICRA or infection control assessment. They use chemicals also. Sometimes they are using hazardous chemical like paints, solvents, glues, welding fumes. Sometimes they use epoxy, they use oil. And some medical cities, they have fuel station, and the gasoline in this fuel station is a big hazard, can fire at any time, affecting the whole hospital. And also other medical cities, they can have oxygen storage, and also it has a fire hazard. It is not uncommon to see rats, rodent, lizard, ants in a hospital. So the best control staff, they use insecticide, fungicides, rodenticides to control these insects or rodents, exposing themselves and the healthcare worker to added chemicals. The famous exposure is the hazardous drug exposure, including chemotherapeutic agent and sometimes warfarin. And the NIOSH, National Institute of Occupational Safety and Health, they have a list of this in 2016, and they are working on updating this list. It will appear in the end of 2020. Mercury is a big problem in our hospitals. And nowadays there is an agreement, international agreement to stop using mercury in the hospital, to hospital-free mercury. So mercury is located in a lot of instruments, not only the mercury thermometer and sphygmomanometer, but also in some endoscopy and esophageal dilators. And if they still using dental amalgam in the dental lab, and you can find mercury in the medical waste stream, exposing the healthcare worker, and it is a big problem. So mercury in the hospital is an evident hazard. In the pharmacy staff also, sometimes they prepare the drugs, the intravenous drugs or solution. They prepare the chemotherapeutic drugs, and they use sometimes latex gloves. All of these are chemical which can affect them. Chemical medical waste coming from the all premises or ward or department from the hospital produce a lot of chemical exposure also, like pharmaceutical waste, genotoxic waste like anti-neoplastic waste, chemical waste coming from the lab, disinfectants, waste coming from the batteries, broken thermometers, pressurized container, and all of this waste, if is not controlled well and probably from storage until disposal, can expose the healthcare worker to a variety of serious chemicals. In some medical cities, they depend on themselves, and sometimes big medical cities, they have power plant, they have water treatment plant, they have ROs, sometimes also they have sewage treatment plant. And all of these plants full of chemicals like polychlorinated biphenyl leakage in a power plant, or chlorine exposure in a water treatment plant, and sewage and other chemicals. So what will be the health effects associated with chemicals? Of course, all of us know that these chemicals can induce a lot of health effects, and we can't, of course, give in detail about this, but they can enter the body of healthcare workers through skin, so inhalation, injection, or by ingestion if they take food and drinks in the workplace, which is prohibited. And this chemical can cause acute or chronic effect, which may be either mild, moderate, reversible, or permanent, causing disabilities, increases the cost of treating them, and maybe cause death. This diagram shows example of the acute health effect and example of the chronic health effect. So acute health effect due to exposure, chemical exposure in healthcare industry can start from just irritation to the mucous membrane, the eye, the nose, the skin, just nausea, vomiting, irritation of respiratory tract, up to other respiratory distress syndrome, injury to the respiratory membrane, burn, up to this. For the chronic health effect, these chemicals can damage a lot of organ, can cause liver cell failure, can cause renal cell failure, can affect the CNS, can cause allergy, dermatitis, asthma, COPD, can affect the reproductive system of the healthcare worker, can cause mutagenic effect, and some of them are carcinogenic listed by the ER. I would like to share with you my contribution in this field as I and my team conducted two researches to study the effect of using disinfectants and chemicals by nurse and this effect on their respiratory system, ventilatory function. It was a 2-year follow-up study. You can find it in the PubMed. And also we studied the occupational exposure to ethylene oxide in central sterile store in a big tertiary hospital, and we studied the effect of this agent among these sterilization workers. You can find it in the internet. So now it is a huge exposure. Indeed, from my point of view, the biological exposure in healthcare industry is well known, well addressed, have big attention from the world and a lot of measures. However, the chemical exposure need to be more addressed, need more attention from the institute and from the administrative part of the healthcare industries, hospitals, to make sure that their workers are protected. So now, how to manage this exposure? We have main 6 items to manage this exposure in the hospital. So number 1 is the pre-employment examination. It is the first line in any occupational health program to make sure that we will employ a healthy physician or healthcare worker who is not at risk or has no allergy to the chemical that he will be exposed, and to make sure that he will be fit to his work. Otherwise, he will have asthma, eczema, dermatitis, or whatever. The second point is to do medical surveillance and periodic examination for the healthcare worker. According to OSHA, they generalized the list for the at-risk chemicals and how to do the periodic examination, what to do and what are the investigations to be done, and how to keep the records, electronic or in certain place. So to make sure that they are safe and they don't have any health effect from the exposure. And this also will test the engineering, environmental control that should be in place to protect them. Also, any chemical should be purchased by the hospital, should be evaluated, assessed by the occupational health department, occupational health team, making sure that these chemicals are safe, they are not hazardous, carcinogenic, because you need to substitute this substance, carcinogenic substance, by another safe product, And if they accept certain risks, they make sure that we have all personal protective equipment needed to use these chemicals or work with it. Because some of them are corrosive, so they need to install eye wash, body shower, for example. Then the hazard communication program, or HAZCOM, a very important program in any hospital to make sure that their workers are safe and they are controlling everything. And we will speak about this program in the next slides. Then safe use and program for personal protective equipment, not only to have a personal protective equipment, but to test the workers. Sometimes like N95 or respirator, they need to be tested and to keep them in a good situation and make sure that they use it in a right way. At the end is a proper management of chemical medical waste to make sure that all of these waste streams are controlled from the source until the disposal. So not only we protecting our healthcare worker, but also we protect the environment. So this is the main items of the hazard communication program. Number one is the safety data sheet. In the old its name was material safety data sheet. Now it is safety data sheet. Means like the benefit of any medication. It is a pamphlet or papers with all information, electronic or written, with all information about certain chemicals, all information that we will see an example for it. So the workers, the employer, everyone in the hospital, they have access to it and they can use it and know everything about the chemicals they are using, and this is what we call right to know. Then material inventory. Every hospital should have a list of all chemicals that present, labeling of all chemicals, and a written program should be available for all workers, then training of them. So this is an example on the right about the construction of the safety data sheet, which includes 16 items covering everything about a chemical agent or a product, so the worker will know what they will do when there is a spill, when there is exposure, what are the first measures they want to do, how to dispose it, and this safety data should be readily accessible for all physician or healthcare workers, user-friendly, currently updated, and in a place that everyone is aware about it. And you know, accreditation institute come to the hospital and check for this system to give accreditation to the hospitals nowadays. So labeling and warning sign, which should explain the content of any bottle, any container, and should be exactly the same with it, to make sure that people will not use something in a usual manner and it is fatal or corrosive or hazardous material. Also, globally harmonized system with this pictogram on the right of your screen that give a very rapid information about the hazard of a chemical. This is an example also of how to make a list or to conduct chemical inventory in your hospital or in any other hospital. So you list all the chemicals that present in the hospital, their location, their quantities, and the at-risk group, and also who is responsible about this by name or phone. This program should be written and accessible to all the employees in the hospital and all healthcare workers. Sometime in their intranets, you can find any piece of information at any time to manage the chemicals in the workplace. At the end, we should train our healthcare workers, giving them training, periodic training, not only once, and also refreshment training, either general training on the hazard communication program, the labeling, how to read the pictogram, how to read safety data sheet, how can you find your safety data sheet, or a special training program, which sometimes go in emergency action plan, and you train them about personal protective equipment for each group, non-routine task, and industrial hygiene monitoring result. So we need also a monitoring program, chemical monitoring program. And I think Dr. T talk about this in detail.
Sorry, Hillary, can you cover?
And at the end, I would like all of attendants to have safe and healthy life. Thank you very much.
Çok teşekkürler. Tam zamanında diyebilirim. Birkaç
Thank you. Right on time. A few questions.